The American Society of Reproductive Medicine has actually issued a statement on this, that since this is not a live virus, it cannot cause you to get the COVID-19 infection, nor does it enter your cells and interfere with your individual's DNA. It has not been associated with any kind of increased risk of miscarriage, inability to become pregnant, or potential fetal birth defects or stillbirths. With regards to infertility, I know that there's been some information out there in the social media platforms that have sort of suggested that it could cause some issues of infertility. And what has been claimed on the social media platforms incorrectly is that the type of vaccine is against the SARS spike proteins is very similar to proteins in the placenta. And what they're alleging is that by getting this COVID-19 vaccine, then you will develop antibodies that will, in fact, attack your placenta. But immunology experts from around the world have totally said this is not possible. But I think now we're already up to about 25 million individuals being immunized in this country. There have been, as I don't know an exact number, but it's been reported to be several thousands of both pregnant women, women who are currently breastfeeding, and women wanting to get pregnant. And we have, again, not seen any sorts of effects. The American College of Obstetricians and Gynecologists states that individuals that are lactating should not be denied access to this vaccine. And in fact, we shouldn't treat them any differently than someone who's not breastfeeding. American Academy of Breastfeeding Medicine also states that this should be allowed. And the theoretical possibility that some of this vaccine could even get into an individual's bloodstream and then get into the breast tissue and ultimately into the infant's digestive system, it would be gone shortly thereafter. And so lactating women should be allowed to have access to the vaccine because their risk is just like everybody else's in the population. I think it's important to have a conversation with your patients and really try to give them just informed, information. And what I tell my patients is first learn everything you can about the COVID-19 disease and everything you can about the COVID vaccine, and then assess your personal risk. Pregnancy definitely is associated with an increased risk from the COVID-19 infection. And it's important that I think to realize that the COVID-19 infection in pregnant individuals is definitely a clear danger. And with the evidence that has not shown any kind of adverse effects from using the COVID-19 vaccine in pregnancy, it's important to let the individual pregnant women at least have autonomy and to make a choice. So I discuss all of this with my patients, and I think as well it's important that we're all looking at the same information here in the United States. And then it's always also important, I think, to stress whichever way you decide with the vaccine or not, we need to still continue wearing our mask, as we're all doing right now, wash your hands, and let's practice social distancing. And we'll all get through this.